We have nursing services that we offer, private nursing, and we're actually seeing a request for this more often than we thought. We also have private physical therapy or occupational therapy. Sometimes someone will finish with their physical therapy through NVNA and Hospice, and they want to continue twice a week to have a physical therapist come out and do their exercise program with them. We also have social work services privately and geriatric care management. And geriatric care management can mean different things to different organizations, but our definition is this is a social worker or a nurse who would be going out to a family who maybe doesn't know what kind of services they need. They have a loved one with Alzheimer's dementia, or maybe they've had a stroke and they need support and help to access what services would be covered under their insurance. Maybe they're a veteran, so they might be able to get veteran services, or maybe financially they need to look at their financial planning and figure out what are we going to do now moving forward to be able to protect the assets of their loved one but also provide care for them, which is a really complex situation, and we do work with several elder care attorneys to help them maneuver that maze, which can be really difficult. So geriatric care management is something I think that people don't always know exists, and it's a great service to actually help to coordinate all the health care for someone, taking them to doctor's appointments, reporting back to the family, coordinating the care. If they need their medications reviewed, the nurse would do that. So there's a lot of services that I've actually seen within my own family that if I hadn't gone with my parents to a doctor's appointment, I don't think they would have known what to do when they got home. So there is a big demand for private care, and I don't think people know it till they're in it. And usually what happens is they're leaving the hospital, they're leaving a nursing home, and the family is now a little bit panic-stricken. How are we going to do this? Because even if you are taught in the nursing home or the hospital to care for your loved one, it's a whole different story when you get home. So we get many panicked phone calls of families when they first arrive home, and we always accommodate to get out there as soon as possible. And I think people don't realize, in particular with hospice, that once they're home caring for their loved one with hospice, it's overwhelming, it's emotional. They may not want to be the caregiver for their loved one. They just might want to be the daughter, the son, the spouse, and have someone else do the care. So we have a great demand for private care in hospice cases. And we do train our staff to work with hospice clients because it is a different type of care. And we also see adult children calling with caregiver burnout for their parent with Alzheimer's dementia, or they've had a stroke or an aneurysm, and they thought that it was going to be okay, but now they've been into it for a while and they're burnt out. So we do see a lot of that, and we run many support groups through NVNA and Hospice, and a lot of the support groups lead to people requesting private care because they're coming to a support group for support and resources and education, and oftentimes what they find is other members in the support group will say, you know what's helped me tremendously is that 2 days a week I have someone come in for 3 or 4 hours and I'm able to get out, and that has helped me so much. And then the other person is thinking, oh, maybe I could do that. Because cost is a concern for people, so you have to work within that, their financial means as well. There's 2 conditions that come to mind. Chronic care, which is what's going on today, is the government's talking about it, everybody's talking about it. Chronic care, keeping people out of the hospital, keeping people home, saving money in the long run for Medicare and Medicaid. But also people want to stay home. They want to stay home, they don't want to have to go into a facility. So how do we keep people home with chronic care? chronic obstructive pulmonary disease, congestive heart failure, diabetes, and usually they have one or two of those in combination. So we see a lot of people with these type of chronic care diseases. Alzheimer's and dementia, which is a terminal disease. It's a chronic disease, but it's also a terminal disease. And the trajectory can be 10 years or more. So what do? How do we help them through that process in providing care and helping them guide them through the maze of healthcare? So we see a lot of need in post-stroke, people who've had strokes or an aneurysm. So we see a lot of need for personal care, showering, bathing, transferring, ambulation, feeding, and then along with that, meal preps, homemaking, housekeeping to help the caregiver.